Hello, and thank you for joining us for this social media live event. I'm Dan Conley, the team lead for executive communications here at Rotary. Today is World Mental Health Day, as organized by the World Federation for Mental Health and endorsed by the World Health Organization. The global designation strives to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. To mark this important occasion and to opportunity for individuals, institutions, and stakeholders working on mental health to talk about their work, President Gordon McInally has assembled a couple experts and advisors in the mental health space here at Rotary to share with you and your clubs some practical advice on how you can get started addressing mental health issues, both with fellow Rotary and Rotaract members and with the people we serve. Now, this is an interactive event, so those watching on Facebook Live and also on LinkedIn and YouTube, we're eager to take your questions, which you can pose in the chat section. We may not get around to posting them in real time or answering them, but we will do our best to answer them on our social media channels soon afterwards. And no matter what social channel you're watching us on, we would love to hear if your clubs are hosting any local conversations or events in conjunction with World Mental Health Day. So joining President Gordon today, we have Alina Kushner, the Manager for Service and Engagement here at Rotary International. Alina is part of the Programs and Grants team. A big part of Alina and her team's job is supporting clubs and districts with service activities from small and very local to more complex, large scale, and international. And her team also oversees programs and helps to guide Rotary's action groups and fellowships, which are taking a major leadership role in the mental health initiative. And speaking of action groups, we're also joined by an active member of the Rotary Action Group for Mental Health Initiatives, Dr. Pallavi Gowda, a primary care physician from Rockville, Maryland, deeply involved in community health issues. Dr. Gowda is also a U.S. Army veteran, and I hope we get a chance to talk a little bit about veterans' mental health issues at some point during our program. Thank you to everyone for joining us. I want to start with you, President Gordon. It was a little over 8 months ago at the Rotary International Assembly where you talked about the importance of Rotary taking a leadership role in mental health. Why is this such an important issue right now? And given the breadth of service projects Rotary and Rotaract members are engaged in already, why do we need to place at least some of our time and attention on this issue?
Well, Dan, firstly, can I join you in welcoming everybody to this webinar? It's great to be able to be part of this on such an important day. I think everybody recognizes that the pandemic and the slow recovery from it made it clear we are facing a global health crisis. I've gone on record as describing it as the next pandemic, a hidden pandemic. And I think our first obligation as Rotary members is to take care of each other, to be caring friends to one another. And that's always been an essential part of Rotary. But that care and attention is just as important now for the people we serve. Mental health touches each of us and every aspect of the work we do. It impacts across all our areas of focus. And as I've traveled the Rotary world these last few months, I've been overwhelmed by the desire of our members to make a meaningful impact in the mental health space.
You know, President Gordon, one of the first actions you took when formulating your mental health initiative was handing a great deal of responsibility for shaping this effort to the Rotary Action Group for Mental Health Initiatives. They not only drew up the 3 goals of the initiative, they also continue to lead and support this effort, and will do so after the term is over. Dr. Gowda, you're a member of the Action Group. Tell us about the 3 goals of the Mental Health Initiative and a little bit about the members of this group.
Sure. Well, thank you. It's an honor to be here. And so we're here today because we understand the importance of mental health awareness. It's crucial as it educates ourselves, communities about mental health conditions, reduces stigma, promotes early intervention. Knowledge empowers people to seek help and foster a supportive environment. However, let's face it, there's challenges that arise and misinformation happens, and that perpetuates stigma. And inadequate resources can hinder effective mental health care. Moreover, culturally diverse interpretations of mental health issues can create barriers to understanding and acceptance. The Rotary Action Group on Mental Health Initiatives identified key concepts that helped another pandemic, the polio. So end polio now, a lot of the key concepts that were made that initiative successful, we're utilizing here with mental health. Main three main parts of the mental health initiative with this RAGME group is to raise awareness of mental health needs. So supporting clubs and at the district level, supporting any district initiatives on mental health projects that are done, as well as reducing the stigma. And so as we talk about it more, it'll be something that should be just, just as much as someone says, I have hypertension, they should be able to say, I have depression. And so that's how we face the challenges and reduce the stigma. And then improving access to mental health services. And so there's a pilot program that's being done with the RAGME group and using a model from the Boston Children's Hospital. And so done in Southwest Florida right now, which is very successful in training primary care doctors to screen for depression, even treat mild to moderate depression and so forth. So, these screening tools are there. The toolkits are really meant so you don't have to have a background in mental health or even a medical education to really to use these screening tools.
Well, thank you for your leadership and everything that the Action Group is doing in this space. It's really important work, and it's certainly a great way for Rotary members to be involved in mental health is to join the Rotary Action Group for mental health. But it's a big ask trying to get started here, and a lot of different approaches Rotary members can take to begin their journey in the mental health field. So I'm going to turn now to my colleague Alina Kushner, who has developed a very helpful guide for members that gives all kinds of practical advice that they can follow to make an impact in this space. So Alina, tell us a little bit about the guide and where members can access it.
Thank you, Dan. The brochure was a true collaborative effort and offers more insight into the timely initiative and strategies for starting or expanding a club or district mental health activity. It opens with a very thoughtful letter from President Gordon, which clearly sets the tone for the initiative's goals and offers ideas for what Rotary and Rotaract members can do both within their clubs and at their meetings and events, and how they might get involved in the community. We received tremendous feedback and support from the Rotary Action Group and its members on the content, including regional and cultural considerations. And so the brochure is intended to spark ideas and discussions within Rotary, and it offers inspiration that can help us take action, start new initiatives, or build upon existing ideas within the three pillars that Dr. Gowda mentioned. And I'd like to take a few moments just to share a few ideas to give a sampling of what's in the brochure. So the brochure invites clubs to consider maybe inviting a mental health professional to discuss practical strategies that address well-being. And I have heard of clubs starting to incorporate some of those activities into their club and district meetings and events. It might be a yoga and meditation session, mindfulness conversations, so on and so forth. Clubs can consider expanding on the great work that our young leaders are undertaking to raise awareness about mental health. Young people are often more comfortable discussing mental health and well-being, and they're taking innovative approaches to reaching a wider audience with a genuine voice. And we can support youth-led campaigns and also learn from their leadership. And building on this idea of learning from one another, we can foster conversations about mental health across age groups by inviting interactors and young leaders to discuss how they and their schools and their communities are approaching and supporting mental health. And together, we can explore the cultural and generational barriers, differences, and similarities for talking about these issues. And then, of course, there's the concept or component of working with other organizations and understanding what the landscape around mental health might look like in your community. And that is typically done through an assessment. And the findings of that assessment can help clubs identify ways to expand access to preventative services or treatment interventions where they currently aren't available. And as President Gordon said, just as important, the brochure offers advice on how we might interact with one another in an open, caring way. I really appreciate how President Gordon models this as going beyond asking, how are you, and getting to how are you really, and investing in genuine conversations. I think being a caring, thoughtful friend, colleague, neighbor, classmate, fellow Rotarian or Rotaractor makes such a big difference, and it is core to who we are as a Rotary community. And so if you haven't seen the brochure yet, you can find it through the Rotary website, directly rotary.org/initiatives 23-24, or you can navigate there by going to rotary.org.
Thank you, Alina. I'm going to turn back to President Gordon. You've certainly touched on an issue that's creating a great deal of enthusiasm among our people of action. And as people of action, they want to jump into service projects. And I know you've been hearing a lot about what Rotary members are in the planning stages with ideas. So tell us a little bit about what you're hearing from Rotary members and how they're planning to take action.
Well, sure. And I think the first thing to say is, having opened the door to this discussion back in January, we're discovering so many people are touched by mental health issues within their family, within their circle of friends, within their work colleagues. And I've been in Rotary now for more than 39 years, and I can't recall a focus that has been as warmly embraced everywhere in the world as this seems to be being so at the moment. Getting news about potential new mental health projects is becoming a regular occurrence for me in my travels. We were recently in Zambia, where I had the opportunity to have a conversation with the Vice President of the country, and she was very interested in what we were doing, was anxious to initiate conversations with local Rotarians to see where the government of Zambia could partner with us and help us work in this space. And that's a country that comes from a continent where mental health is so taboo. And if we think it's stigmatized in our part of the world, then it's even more stigmatized in a continent like Africa. And then only 10 days ago in Italy, I had a meeting with the mayor of Rome. And again, we had some very interesting discussions, and he was keen to work with the local Rotarians about potential local collaborations for service projects addressing the issue there. Even before my presidential term began, I was made aware of and was very impressed by service projects already underway in places like India, particularly the Wellness in a Box project that provides great practical mental health training for young people in a format that's highly scalable worldwide. And then in Korea, Rotary is helping to build the mental health infrastructure in that country by making major investments in support centres for the victims of child abuse. Moving to the Philippines, there's a great project underway there just now, a women's health centre that was established a few years ago and soon after discovered that they really needed a mental health component to their care, and they worked hard to establish one. In the US, in Colorado, there's a tremendous access to care project underway that is being fully funded by a mental health professional at pediatric hospitals across the state. And there's an endowment fund in place to cover these resources perpetually. This is a great sustainable solution. But I'm really just as excited by efforts taking place at the club level to raise awareness. And there are so many of those. A great example would be the Rotary Club of Tortola in the British Virgin Islands. Earlier this year, their Rotaract Club invited a young woman to speak about the unique challenges she faced in regards to her pregnancy and mental health. And this inspired the Rotary Club to also invite her to speak, and in turn that led the Rotary and Rotaract clubs to collaborate on an awareness project to paint their town green on May the 4th in conjunction with World Maternal Health Day. So if you wonder how to get started, just start small. Invite a mental health professional or someone well known in your community on the subject. Invite them along to your Rotary or your Rotaract club meeting. It all starts with opening up and sharing.
Thank you, President Gordon. These stories are so inspiring. The Colorado project that you mentioned, that we learned about that through our email box, which is mindhealth@rotary.org. And I get to curate that box. And let me just, that is like the best moment of every day is opening up that box and reading what's coming from Rotary members. And we encourage you to keep sharing your stories or any thoughts you have about the mental health initiative, including if this program. Share your thoughts there. And I want to remind you that that you can keep talking about this program, but also your club or district health projects in the chat, and we will eagerly follow up with more details. Speaking of club meetings, Dr. Gowda, I've heard that you were instrumental in creating some mental health and wellness surveys that clubs can use to gauge how members are feeling and identifying challenges individuals might be facing. Can you share a little bit about how these efforts began and give some guidance about how clubs can use surveys like this if they're interested?
Sure. So, Rotarians, we are powerful in that we are healers. We may not see ourselves that way, but when people see a Rotarian, they think of a healer, someone who's really helping humanity. And so the concept is to help the healers. Rotarians devote so much time and energy in helping others. And so we also have to keep in mind that we have to help ourselves in terms of making sure that we are mentally aware. And so the idea originated as a battle buddy concept that, I was in the Army. This is something that was really ingrained in us, where we looked out for our fellow service members, and we were taught numerous times to identify the warning signs of depression and so forth. And so when we had the discussions in our RAGME group, many reflected that given our structure of Rotary clubs and being a volunteer organization, that way, the best way to translate the battle buddy concept was to create this 1-minute mental health check that can really be done at the beginning of any club meeting. And so given how many clubs there are in Rotary International and how many lives we can impact, we can really, truly make a difference. So these can be utilized in meetings, and they bring awareness to mental health. They're also anonymous, so in the sense that if you don't want to share the results, you don't need to. But it's really more of a screening tool to alert ourselves to say maybe we need to seek further care. And that further care is the primary care doctor in terms of who to speak to. But again, these tools are meant to be quick and effective and identify screening for depression, basically. But I think if we take care of ourselves, it's like putting the oxygen mask in the airplane, as they say. If we take care of ourselves, then we'll be able to help others better. So we'll be better Rotarians.
Great. Thank you, Dr. Gowda. I want to return to that issue of primary care physicians with you a little bit later. Alina, in addition to the Rotary Action Group for mental health and activity at the club levels, there are other ways for Rotary members to get involved in mental health. Can you share a little bit about how Rotary members can use some areas that you know very well, a variety of action groups and fellowships to become engaged?
Yeah, that's right. Several of Rotary's 25 action groups work within the mental health space. We've heard from Dr. Gowda. We have the Rotary Action Group and mental health initiatives, and their primary charge is to support clubs and districts with mental health projects. They also offer professional development and learning opportunities for members and guests, and they provide meaningful ways for those who are experts in this space to use their skills and offer guidance and to support to clubs who might not have that expertise and are looking for a little bit of assistance. And so there are other action groups who work either directly or kind of more holistically in the mental health and health space. The Rotary Action Group for Addiction Prevention helps clubs and districts take action to prevent and reduce drug usage and addiction, which also directly ties to mental health and well-being. Our Rotary Action Groups who support women's health, like the Reproductive, Maternal, and Child's Health Rotary Action Group can support clubs with service projects that help women access care. And that includes pre and postpartum care, which ties into support for postpartum depression. The Rotary Action Group Against Slavery is supporting clubs and districts with efforts to eradicate all forms of modern slavery and human trafficking, and to connect survivors to supportive services. And so certainly part of that may include counseling and mental wellness support. There are more examples of how our action groups are incorporating mental health priorities and considerations into their suite of expertise, and how they support clubs and districts with related projects. So you can find more information about our action groups work, request their assistance, or get involved by joining by visiting rotary.org/action groups. And I'd also like to touch upon Rotary has more than 110 fellowships, or I like to think of them as global special interest groups. They're individuals who come together around shared hobbies, professions, and identities. And this is really modeling how our members are building a global community. Our fellowships host events, learning opportunities, and they provide a platform to create meaningful connections within our global community of 1.4 million Rotarians and Rotaractors. And I think that opportunity and platform for connectivity, whether that be in person or virtual, is so powerful. These social experiences are the fabrics of lifelong bonds and meaningful friendships. If we think of how we form friendships, right, they're over shared passions, careers, life experiences, and whether that be gathering with Rotarians and Rotaractors and friends in a different city every month, for example, to run a marathon while wearing your Rotary gear, or it's learning about the art and the craft of winemaking while enjoying pairings with food and enjoying that with friends, or engaging in professional development opportunities, whether that be through virtual platforms or in person, around topics like public health and mental health. All of our fellowships are providing opportunities to build community and offer learning and service options in advance that relate to mental health. So I like to highlight that as a really nice way of building those connections within Rotary. And since President Gordon first discussed the importance of mental health to Rotary at the 2022 International Assembly, it really has been incredible to hear from so many from around the world with examples of how they're prioritizing taking care of themselves, taking care of one another, and taking care of their communities. And so an example of this is the Rotary Fellowship of Military Veterans, who provide a platform for their members to connect over shared experiences and service to their country, but is also elevating the important conversation around veterans' mental health. The fellowship will be hosting a virtual global symposium on veterans' mental health next month on the 11th of November. And so the event will raise the awareness and address stigma around veterans' mental health, and will offer strategies for healthy habits. But also, I think a big component of this work and the conversation is advocacy and advocating for improved resources to support those who serve their country. And so we can all follow their lead and think about how mental health is talked about in our communities, whether mental health is an existing component of our projects, and incorporate that into the work that we're undertaking.
Yeah, thank you, Aline. I think one of the really exciting things here is that everything that Rotary members can do to become more engaged with Rotary, everything we do to build stronger clubs, to build better service projects, all these things are great for mental health. So we're kind of doing these things at the same time, and fellowships and action groups are a great example of that. I want to return to Dr. Gowda on this subject because we did touch upon veterans issues, and you're a veteran of the U.S. Army. You've spent quite a bit of time in this space. Can you talk a little bit about veterans' mental health care and perhaps some of the challenges that you've seen and ways maybe Rotaract and Rotary members can support military service veterans with needs worldwide? And while we're kind of hearing from you about that, I also wonder about some of the other particular areas expertise that you have, such as mental health issues in South Asia, and perhaps a little bit about the role that general practitioners like yourself play in providing access to care, including something Bob Anthony wanted to make sure that I raised, that we talk about, an innovative new program called A Lever. So lots to touch on there, but please take your time, Dr. Gowda.
Sure. These are all topics that are very passionate to me in helping these population groups, whether it's veterans or South Asians or Rotarians all around the world. This is something deeply of passion to me. And I love the fact that you both mentioned how the connectivity and, helping others helps ourselves. We have certain hormones, dopamine, serotonin, oxytocin, that get released within us when we help others. So we should realize as Rotarians, we've already been doing this. We just might not have realized it. And so, but when it comes to the veterans specifically, supporting military veterans and mental health necessity is really a multi-pronged approach. It's vital to provide accessible, tailored mental health services that address unique challenges faced by veterans like PTSD and depression. Encouraging open discussions around mental health can combat the stigma, promote a culture of understanding and acceptance. Peer support groups can also be incredibly beneficial, as in the fellowships and even within Rotary clubs, in order to create a supportive community. Additionally, promoting job opportunities and assisting in transition back to civilian life can really alleviate stress. Government, nonprofits, community efforts, it's all needed in order to collaborate and ensure that veterans have the necessary resources in order to thrive post-service. Now, when it comes to the South Asian community, the South Asian community grapples with specific mental health challenges, and really the overarching themes are similar in the sense that there's a cultural stigma that's often prevalent, which has to be overcome. And so associated with mental health illness seen as a weakness or a personal failure, or deterring many from basically seeking help. Traditional values emphasizing family honor can suppress conversations about mental health. Additionally, intergenerational conflicts and pressures related to career or marital expectations can compound the stress. Barriers to care include limited access to culturally competent therapists, language differences, general lack of mental health literacy as well. Misunderstandings about mental health treatments, financial constraints, and concerns about confidentiality further hinder many South Asians from accessing the care that they need. And as I stated, you hear recurring themes of needing the awareness and the education and the reducing the stigma, all what we are doing here at Rotary. And so in terms of the importance of a primary care doctor, I would say that's your first person to go to, kind of like the quarterback of your healthcare team. If you have any questions, whether you're facing a mental health situation or not, that would be the first person to go to. There's screening tools that can be put in place. There's referrals to psychiatrists or other specialists if needed. So, big advocate of primary care medicine, as I am a primary care doctor myself.
Great. And could you tell us a little bit about that program, a lever that Bob Anthony is spearheading, I believe, in Massachusetts?
Yes, I did mention a little bit earlier, but so it's a program out of Boston Children's Hospital, and they're basically, the whole premise is to increase access, because there is a nationwide and a worldwide shortage of child psychiatrists. And so they're working with the focus group of the pediatric population. And so they are doing behavioral health trainings and getting pediatricians and family medicine doctors who also see children trained in behavioral health, because this is not something that we have extensively in our healthcare education system. So having the first frontline providers more comfortable with mental health means that more is getting addressed, more is it's a matter of being proactive. And so that's really what it is. They've had great success, and I know they've got data to back it up, and they're very, it's a wonderful program. It's a much needed program too.
Well, thank you, Dr. Gowda. And we've heard about so many wonderful approaches underway. To wrap up this discussion, President Gordon, I want to return to you and just give us an idea of where you see this going over the next 9 months, and after your term is over, what do you think Rotary's role in the world is in mental health? What do you hope to see happen? Both in Rotary clubs and in the projects that we create and bring to the world.
Well, Dan, I think the first thing is to talk about the years ahead, because this isn't something that's going to be wrapped up in the next 9 months. And it is something that I think Rotary needs to remain at the forefront of going into the years ahead. And throughout the rest of my term, we will be focusing on ways for members to be involved in mental health and all the ways that affects the work we do. In December, I'll be speaking at the COP28 summit in Dubai about climate change and mental health, especially the crisis level care we're seeing as part of disaster relief efforts. I was on a call recently and people were talking about the cases of eco-anxiety that are springing up, not just among my generation, where we are so concerned about the changes in climate and how it's going to impact on the younger generations, but indeed in the younger generations as well, who are anxious about the future and what is the world going to look like for them in the future. And so it's really important that we link climate change and mental health, and I look forward to taking the opportunity to do that in Dubai. Our upcoming Rotary International Convention in Singapore next May will also place a special spotlight on mental health. And we would love to see everybody on this call today there. We want you to come and share some inspiring stories. We will be sharing inspiring stories with you. And let's work together to create hope in the world through this focus. I think the most important part of this whole jigsaw is the Rotary Action Group for Mental Health Initiatives, because it is that group who will continue to show leadership in this area long after my term is complete and Gordon McInally has been forgotten about. And we're working hard to assist them in this ongoing effort. I think it's important to remember that while mental health is not an area of focus, and a number of people have said to me, can it become an area of focus? I don't think it needs to be an area of focus because it fits so comfortably within all of our areas of focus. There are opportunities for you to make a difference at every level, in your clubs and in your district, through your advocacy, through awareness building, and through service projects. But also remember, and it's very important not to forget this, that just reaching out and caring for your fellow Rotary and Rotaract members, the communities we serve, and our partners in service, makes a huge difference as well. Statistically, we're told that 1 in 5 people suffer from poor mental well-being. Well, it doesn't take a mathematician to work out that in an organisation of 1.4 million members, there's going to be 70,000 who are suffering from poor mental well-being and therefore need the support of their fellow Rotary members. And I would encourage everybody to start locally. Start in your own clubs. Make sure that our clubs are caring spaces, safe spaces, so that our own members feel well cared for. Because as already been said, until we're caring for ourselves and at peace with ourselves, it's very difficult to serve the public. So that would be my concluding message, Dan, and thanks again for giving me the chance to be part of this.
Well, thank you, President Gordon, for your leadership on this important issue and for taking the time to share these updates. I think that this has really been a very informative discussion about how Rotary members can very practically begin to take action here. And I also want to thank Dr. Gowda and Alina Kushner for sharing their ideas and insights. And I want to thank our social media participants for sharing your thoughts and stories in the chats. For viewers in all social media channels, please continue to add your comments about activities you're taking to address all 3 goals of the initiative. And please send emails to mindhealth@rotary.org. Let me tell you, when I have a bad day, I go to that box, and it is always an inspiring moment for me. And please share your thoughts about this program as well. And we would love to hear more about your projects. Please visit the Rotary Showcase to share your experiences. So Thank you, everyone, for joining us today and for carrying this priority forward. For more information on the Mental Health Initiative, please visit rotary.org/initiatives23-24. And thank you for joining us.